Hey everybody, Dr. Frank here with Total Life Chiropractic behind the camera, and with Dr. Mike and Dr. Sonny with a tale of two spines. I like that, Dr. Mike. You coined that phrase.
Yeah, well, every day in the office, and Dr. Sonny and I were just talking about it, you're going to see two different spines coming through the office. So the effects of misalignment for the spine and somebody who has had a healthy, active spine. They've been adjusted properly. So, Dr. Sonny, would you tell them a little bit about somebody who didn't have proper alignment?
Well, you can take a look at this spine right here. This is one spine that was not taken care of, right, in our office here. Something that was just thrown around, wanted to show our patients, whatever. Well, when you don't have a spine that's properly taken care of, things are going to start degenerating and creating arthritic joints. And things are going to start moving out of alignment, creating improper nerve function, improper biomechanics that doesn't allow the body to function as optimal as it should. Versus a healthy spine that gets corrected. Dr. Mike?
All right, well, these two spine models were bought around the same time. Now, that one looks a lot better than the other one there. This one, unlike our other spine, was hung up properly, taken care of. This one was beat up in our adjustment rooms a little bit. So with it, we're just showing patients it gets thrown around, things like that, little wear and tear throughout the day. So when you are properly aligned, you're less likely for things to break down and wear out. It's important to get properly adjusted, looked over frequently, and you're less likely to look like, well, that model over there.
So those misaligned vertebrae, like anything that's out of alignment, will wear down faster, right?
Exactly.
Yeah. What's that common thing you hear? You were just talking to me about that the other day. When a patient comes in, they have arthritis in the lowermost part of their spine or in their neck, and they'll say, well, my doctor said it's because I'm old.
Well, one of the big ones we hear about is repetitive injury. Well, you can have two people with the same job all throughout their life, doing the same exact job. How come one of them ends up limping through the door, the other one comes walking in just fine? Well, a lot of times it's when did they come see us? Somebody who got on top of it early, you're going to be staying corrected, staying active, and your body's getting repaired along the way. Somebody who is dealing with improper alignment, you could be doing that exact same job. All of a sudden, you keep letting things go, and you're waiting for something to fail on you. If you wait to come through the door for something to break, now we're dealing with something that could even be with arthritis, something that looks more like the spine over there.
So they don't have degenerative or wear and tear arthritis or osteoarthritis as it's called because they're old, right? Because the whole spine's the same age. Why is it in one area and not in another?
Well, that's because of the improper biomechanics and misalignments that we detect and correct here as chiropractors. When you have misalignments at certain joints, next thing you know, what we measure here, we measure curves, we measure angles. We look at all that, and if you have improper, non-optimal curves and angles of certain vertebrae, yeah, they're going to start wearing down improperly. It's like having your tires not rotated on your car. Things are not going to be wearing down or moving properly, which will lead to extra wear and tear.
Dang, you guys are really good. Am I going to lose my job here as the guy on the other side of the camera?
No,
Maybe. Well, thank you, everybody. You guys have a great week. Enjoy the weather, and we look forward to seeing you.